Hello, and welcome to Lunch and Learn here at Cleveland Clinic, Ruvo Center for Brain Health in Las Vegas, Nevada. My name is Verla Niebuhr, and I am your Education Program Manager. As always, I like to begin by thanking each of you for your attendance. It is truly valued and appreciated. As a reminder, this program has been designed for you. So to make it more your own, we invite you to place your questions and your comments in that Q&A box that is easily found on your Zoom toolbar. Just click on that little talk bubble and type away. We're going to stop intermittently to address your questions. At the end of today's program, you'll also receive a survey in your inbox. If you would, please take the time to complete that survey. It really helps me know what we're doing well here, what we need to improve upon, and what your future hopes and desires are for this platform. So, March is known as Multiple Sclerosis Awareness Month. This complicated neurological condition tends to impact some of our youngest patients here at the clinic. Yet, their positivity and resilience never cease to amaze me. So, to those of you who are out there living well with MS, thank you for the lessons and light that you share. So in today's session, we're going to talk about progressive MS. We'll explore the many ways to manage symptoms common to the disease as it progresses, including medication, therapy, exercise, and lifestyle changes. Leading our discussion is Dr. Alison Carlson. Dr. Carlson is a staff neurologist at the Mellon Center for Multiple Sclerosis Treatment and Research at Cleveland Clinic in Cleveland, Ohio. She is an assistant professor of neurology at Case Western Reserve University and the Cleveland Clinic Lerner College of Medicine. Dr. Carlson attended medical school at the University of Minnesota and completed her neurology residency training at Cleveland Clinic in June of 2021. She then completed a 2-year subspecialty fellowship at the Mellon Center for Multiple Sclerosis Treatment and Research in June of 2023, during which she also completed a master's degree in clinical research through Case Western Reserve University. My, oh my. She joined the Mellon Center staff in July of 23. Dr. Carlson currently cares for patients with multiple sclerosis, MOGAD, NMOSD, autoimmune encephalitis, and other neuroinflammatory conditions. Her clinical and research interests includes family planning or management of pregnancy in patients with neuroinflammatory disorders, access to neurological care, and clinical outcome measures. While you can see that she has an extensive education and acclamations, what is most telling about her is her 5-star rating with patients as a physician and some of their incredible comments in their reviews. Statements like, "This was the best care I've received from a specialist in my healthcare journey. She was so caring and asked questions that no one else has. I'm very excited and hopeful to continue treatment. This is an excellent doctor, patient and thorough. Saved us time and money with a Zoom call. Thank you and thank her very much for this service." And then this comment, very astute and caring physician. And finally, I picked one more because there were so many to choose from. Dr. Carlson is excellent. She takes care of my concerns. She takes care I'm sorry, she takes all of my concerns into consideration and I feel cared for. So I just wanted to include those because a lot of times doctors don't ever look at their reviews, and she probably doesn't even know that that's been said about her. But anyway, so my friends, I just want you to join me in welcoming our very special guest, Dr. Elise Carlson. Dr. Carlson, take us away.
Thank you so much for that kind introduction, Verla. That was very sweet. And you're right, we oftentimes don't find time amongst everything else we're doing to take a look at those. So it was nice to take a minute and just reflect on that. But I think that was a very nice segue into what we're here to talk about today. And again, Verla, you set the stage perfectly, kind of just alluding to the resilience of the patients living with this disorder and giving us the opportunity today to talk about how we can make your MS journey better. So the title of this talk is Progressive MS, Taking Control of Your Symptoms. But I did want to mention that many of these symptoms, whether you are, been termed relapsing remitting stage of disease or progressive, a lot of these things apply across the spectrum of MS. So hopefully you will find something worth value in what we discuss here today. And I did want to take just a moment again to acknowledge that this is Multiple Sclerosis Awareness Month. And by saying thank you to all of my patients, it's an absolute honor to be involved in the care for you all and the MS community as a whole. So this is a brief overview of what I'm aiming to cover today. There is a lot of information here, so we'll take pauses throughout to answer questions kind of pertinent to each of these sections. You can see we've outlined 6 main areas. I'm going to start by setting the basis with some comprehensive wellness aspects of care. And then we'll kind of delve more in depth to various areas of function in neurology and symptoms, including motor symptoms, which includes things like your strength, spasticity, which is muscle stiffness, and ambulation, which is the medical term for walking. We'll talk some about bowel and bladder symptoms. We'll talk about fatigue, mood dysfunction, and cognition, which is the medical term for thinking. So I wanted, again, to kind of open up by showing you guys a brief summary, and you don't need to pay attention to the numbers and the nuances here, but this was a community-based survey of MS patients asking them, what symptoms do you have and how do they affect your day-to-day living? And as you can see here, this list is long, right? MS patients experience a lot of different symptoms, and you can see that the numbers here for some of these symptoms are quite high. You can see that fatigue is experienced by over half of the MS population on a daily basis. Balance problems are very common, as are problems with weakness, bladder, muscle pain and stiffness, and so on. And I just wanted to present this slide to not only show the spectrum of symptoms that are experienced, but also to take the time to mention that everybody's MS manifests a little bit differently. Some people may experience 1 or 2 of these symptoms. Some people may experience multiple of these symptoms. And the degree to which you experience these symptoms can change throughout your MS journey as well. So as I mentioned in the introduction, we are going to set the stage by briefly talking about some comprehensive wellness strategies. And this is something that we tend to highlight repetitively with our patients at the Mellon Center, because if these things are out of place, if these things are not being addressed, it's really hard to make good progress in successfully managing your MS-related symptoms. So I presented a figure here that's from the American Heart Association, just because I think it depicts nicely a lot of these things that go into creating the holistic approach to the patient, okay? And those things include aspects like maintaining a healthy diet, exercising, moving your body, and no matter what capacity that may be or what that might look like, managing your weight, avoiding smoking, and then addressing things like behavioral issues and mental health concerns, right? All of these things play into your overall quality of life and your overall health. I also put in a mention here of other things that are ancillary to the care MS patients receive from their physician or their provider. And those are things like social work support, support from rehabilitation services from all aspects, physical, occupational, speech. I haven't listed here cognitive therapy, but all of these things kind of contribute to this holistic approach to the patient. So we'll go through each of those aspects in turn, just to again set the stage for this and give you guys some information about what you can be doing to help support your MS journey. In terms of diet in MS, this has been a hot topic. It's been researched many, many years, and over time, I think what's emerged as having the most significant evidence is a Mediterranean style diet. And you can find lots of information on that by just Googling that term and kind of get a good idea about what foods that entails. But in general, this approach is limiting sugar and processed foods and limiting high sodium foods. I also didn't mention on there nitrates, right, which are part of the processed foods that can exacerbate, meaning make your MS symptoms worse or cause your symptoms to flare. And the diet also emphasizes things like whole fruits, vegetables, grains, lean proteins, and fish. We know that the Mediterranean style diet is good for the population at whole, but there has also been evidence produced that have showed that there may be added benefits in individuals with MS by helping to more effectively manage other things that are highly correlated with brain health, particularly with risk to the cerebrovascular system. So your heart, your arteries, your veins, which if uncontrolled can make MS progress much more rapidly. So just to put that bug in your ear, Mediterranean style diet is a good approach and a good starting point to living better with MS. What about exercise? We know that exercise can lead to small but very important improvements in multiple aspects of neurological function. Although it's maybe somewhat counterintuitive, exercise and moving your body can significantly help to combat fatigue, so the amount of tiredness you feel throughout the day. It can help your thinking be more efficient. It can help your mood, so offset things like depression and anxiety. And it can help maintain your motor function, which in turn helps support your walking and your balance, preventing things like falls and keeping you mobile. And all of these things culminate together to improve your quality of life. We also know that there are significant benefits for other medical problems, right? Like heart disease, cholesterol, high blood pressure, and that being active helps promote quality of life and your social relationships. So for all of these reasons, exercise is a good idea. And to give you all a tangible to take home with you, what do we recommend? So typically we ask that our patients aim for at least 30 minutes of aerobic activity twice a week. That can be something as simple as walking around your neighborhood, right? But getting up and moving for 30 minutes twice a week. And then doing strength training exercise for your major muscle groups. That means your upper body, your chest, your arms, your abdominals, and your legs. If you can exercise those muscle groups twice a week, that kind of helps to maintain and build that nerve muscle function that is necessary to keep you at your optimum. And then we do encourage all adults to continue to exercise even as they age past the age of 65, but under the supervision of their primary doctor to make sure that there are no contraindications related to things like your heart health, your lung health, etc.
So, Dr. Carlson,
Yes.
just a really quick question because you said let's exercise to combat fatigue. So, how does that work? And how is it that, like, so if you exercise to combat fatigue, then at the end of exercise, does that take you out for the rest of the day? Tell me about that.
So it can, and that can be a very difficult balance to strike. As you mentioned, we'll talk about this in more detail when we get to the section on MS-related fatigue. But because fatigue is an inherent part of the MS spectrum of symptoms, someone might start with less reserve, right? With less energy overall to use and allocate throughout their day. And you might have a lower endurance than you did before MS, right? So kind of striking the balance between what you can handle and what feels good to your body and what wears you out can take some time. Um, and we'll talk about how fatigue can worsen MS-related symptoms temporarily as well, which does happen, especially if you're new to exercise and kind of just getting used to moving your body. But typically that improves as your endurance builds and your muscle strength, and again, those connections between the brain and the muscle get more efficient. And can actually lead to things like better sleep and better mood, right? Which improve your level of fatigue overall.
Is
This is
there
a
a better?
long-winded answer.
Yeah, no, that's great. Is there a best time of the day, or does that depend on the person?
I
To
think that really
Mhm.
depends on the person, again, because everyone's fatigue is somewhat different. Some people notice that they wake up feeling unrefreshed and it takes them a while to get going throughout the day, right? That person might not be a good morning exerciser. Other people notice that, because of other demands in life, like work or family life, that, they don't have time to get to that until later in the day and they have to push things until later. But then, it raises the question, how do you kind of spend your energy bank throughout the day so you still have some energy left to exercise at the end of the day? And that can be challenging. But I would say my overall take-home message is to start low and slow, right? Even moving your body, if you're new to exercise, 5 minutes a day is a huge accomplishment. And then increasing by a minute or two every few days, and you do that for a period of time, and you're up to that 30-minute mark. And again, it doesn't have to be running a marathon. It's just kind of getting your heart rate up to help your blood circulate, and circulating your blood has really good anti-inflammatory effects on your body, which in turn help with from the MS disease control standpoint, but can also help with things like your energy level and your thinking capabilities.
Okay. Thank you for taking time to answer those little quick questions. Let's go back to your slides.
Of course.
Mhm.
Okay. So now just a quick note on smoking and nicotine use in MS. It's not news to anybody on the call, I'm sure, that tobacco use, smoking, including vaping, is associated with worsening of inflammatory MS activity. And people with MS that are smokers tend to have slightly shortened lifespans, right? So if anything is motivation, that's it right there. We know that people who quit, no matter, how late in life with MS, their long-term outcomes are much better if they quit using tobacco products. Furthermore, because we all know that nicotine has negative effects on the blood vessel system, which we mentioned in the first one of our early slides. If those factors aren't controlled, it can lead to more rapid shrinkage of the brain and worsen your MS symptoms. So, take-home message here is, if you are a smoker and are ready to quit, please ask your provider about resources. We have quit programs. We have medications that can be utilized. We have support groups. This is one of the things when I'm meeting someone for the first time, if they're telling me they're an active smoker, that's kind of my number one priority, because that is what is really going to be the thing that's under your control that will make the most impact of what you can do for your disease.
Dr. Carlson, we do have like a smoking question, but not for
Sure.
cigarettes. But it says,
Okay. Yes.
given the recent legalization across the states, what about marijuana addiction? Is it good to quit for MS, especially given weed seems to damage short-term memory? I don't know.
Yeah, great
Mm-hmm.
question. And now I'm regretting not putting a slide in here, because that is, I answer that question multiple times a day. And I think that the take-home message for marijuana is a little bit mixed, right? Because there has been a lot of interest in the use of cannabidiols, or CBD, which is one of the components of marijuana that is a neuroactive substance and has quite good evidence actually for helping with pain control. And I do think that that holds some validity. And I do think that those treatments probably will be developed further in the future and will become clinically available. Now, the question is, how do we get that benefit with, raw products, right, with marijuana? Because those come with a whole bunch of other variables. I have patients that, use marijuana products in multiple different ways, similar to smoking, right? The combustion, meaning the burning, and the smoking and inhalation, regardless of what you are smoking, is very damaging to your blood vessel lining. So even though the marijuana can help with pain, and again, good evidence for that, the smoking of the marijuana can be very damaging to your blood vessels and inflammatory and can actually flare MS. So my recommendation to my patients who feel that they benefit from marijuana products in terms of their symptom control is to ingest it in other ways, whether that's tinctures or gummies, just because that tends to be somewhat less inflammatory. But again, I say that with a caveat, right? Because most of these things, all of these things are not FDA regulated, meaning what you get in one formulation or from one batch of something to the next may vary quite significantly. But if one were to use it, I would say smoking would be the least preferable mode. Does that help answer that question?
Yeah, thank you. You really did take it on. Of course, I have to remind people that it's not always legal in every state. And so if
Right.
you happen to be living in a state where marijuana is not legal, you really need to go another direction. And then I just wanted to read this comment from one of our viewers. My good friend Jack. Hello, Jack, miss you. Anyway, smoking propels you into your future faster. So, meaning, yeah, I think that's a good insight, Jack. Thanks for sharing.
Exactly. That was beautifully stated. And summarized kind of my long-winded rant about how the inflammation impacts your blood vessels, right? You're absolutely correct. Is if we're causing that constant inflammation in the blood vessels, it's going to cause accelerated brain shrinkage, making your MS symptoms worse. Beautifully stated.
Indeed. Thank you. All right, let's go on to the next one.
Okay, that was fine because we're actually just about to transition into motor symptoms. And again, this kind of encompasses a few different things, so we'll go through those in turn. Just briefly acknowledging, right, that weakness and problems with motor function in MS is very common, right? Whether that be due to weakness, whether that be due to severe fatigue or incoordination, all of that can impair how your muscles work together to accomplish what you need them to accomplish. I always mention to my patients early on that it's normal for these symptoms to fluctuate from day to day or even within the same day, right? Depending on what you're up to, what's going on in your life, if you're particularly busy, if you've slept poorly, that can all impact how your symptoms feel differentially from day to day. Weakness and motor function can gradually worsen throughout your disease course, right? So oftentimes if we're diagnosed someone very early on and they presented with an issue, say leg weakness on one side due to a lesion in their spinal cord, oftentimes we'll treat them, we'll get them started on therapy. It improves or stabilizes for a period of time, but as they progress through time, and particularly when people hit the second or third decade into their diagnosis, they might start to notice that those symptoms are worsening or becoming more noticeable. And that's because as your brain and spinal cord ages, you have less reserve, right? Meaning your body is not able to compensate for those scars that are on your brain or spinal cord as well as you could 20 years ago. So not uncommon. It is frustrating though, right? And it's important that you communicate that to your doctor if you are experiencing that so that we can help to intervene and lessen that progression of that motor function. As I'm sure many of you with MS and those caring for people with MS know that there's no magic bullet out there that can help to restore function once it's been lost. So we have to put a lot of effort into preemptively maintaining the function that you do have and the healthy connections that do exist. And oftentimes that's through, again, a personalized exercise regimen and through the help of a physical therapist. And if you can get in contact with someone from a therapy team that has some experience with neurologic disease, MS specifically, that's wonderful because they often understand these nuances and these fluctuations that patients experience and can help formulate a plan that works for you. Okay, so next we're going to spend a little bit more time on spasticity. And I've learned that this is a term that is not widely understood. So I just wanted to briefly explain what happens in spasticity. So when you have lesions in your brain and your spinal cord, there can be blockages between the nerve cell that lives on the surface of your brain and the muscle where it's sending the signal to, right? And in order for us to move our muscles the way that we want to accomplish the things we want to, there's a constant give and take between muscle activation, which means contraction, which makes the muscle strong or stiff, and relaxation, which makes the muscle loose. What happens when the pathway is blocked is that the relax signal that's supposed to be coming up from the muscle gets blocked. And so you basically just have this increased tone in your muscle that causes stiffness that is out of your control. Some people experience constant stiffness in their muscles. Some people experience brief jerking movements, and some people experience Charlie horse-like pain. These all can be manifestations of spasticity. And they can interfere with what you want to do, right? What you want your legs, what you want your arms or hands to do. These abnormal movements can be quite bothersome. And they often become more obvious with fatigue. So the more you use your muscles, usually people experience late in the day, I sit down on the couch after a day of work and I notice that my legs start getting really tight, or I start getting these Charlie horses. Or, hey, doc, I'm trying to sleep at night and I keep getting these terrible cramps that are waking me up at night. Those are due to spasticity and they can be treated. This, again, a little bit of a sciencey slide, but just to highlight that spasticity is really common in MS patients, right? So almost 3 out of 4 across the board, multiple studies across many, many years of evaluating this have shown that it's a highly prevalent symptom. So what can happen when spasticity is untreated? Well, I already mentioned that the increased tone and spasms can be very painful. It can cause decreased dexterity, meaning you can have difficulty using your hands. This can cause problems with handwriting, with things like brushing your teeth, buttoning a shirt, tying your shoes. When it involves your arms and hands. When it involves your legs, it can cause problems walking, right? Your feet might turn in on you and cause your toe to catch on the ground and cause a tripping hazard. These can cause problems with sleeping, as I mentioned. You might have problems taking care of yourself and cleaning yourself, right? Because if your muscles are stiff and you can't move your arms to clean what you need to clean, that can be problematic. It can also cause problems with, getting in and out of the car, with positioning yourself for sitting comfortably or for laying down flat for that matter. And then kind of the end stage of spasticity when it's left untreated is when someone develops what we call contractures, meaning the muscle's been stiff for so long and the tendon has been allowed to be shortened for so long that it kind of gets difficult to stretch back out, right? So you might notice that a muscle at a joint will only go so far, right? And it's hard to kind of push it past that point. So what can we do to prevent this, prevent it from reaching that stage and make your symptoms more noticeable? Well, again, physical therapy, exercise, stretching, those are going to be your mainstays. I recommend that my patients, at minimum, stretch right away when they get up in the morning and right before they go to bed at night, and then as often as your day will allow you in between, right? Stretching is great for anyone that even has early signs of spasticity. Oftentimes, we also do need to add a little bit of some sort of medication to help restore that normal contraction relaxation circuit, okay? The two most commonly used medications are baclofen and tizanidine. Those are what are called antispasmodic medications, meaning they keep your muscles a little bit looser. Okay. Sometimes people will only need a small dose at bedtime to help get them through that painful period at night. Some people use them around the clock. It just kind of depends on you, your body, when your symptoms bother you, and what parts of your body are impacted. Okay. Medications work great for people that have multiple limbs that are spastic because taking a pill kind of allows the medication to work throughout your whole system. Okay. However, some people might find that they just have a single muscle group or a single muscle that's bothersome, for instance, causing their foot to turn in when they walk, right? In that case, someone might not need a pill that goes and causes, relaxation throughout their entire body. And those people might benefit more from putting medication directly into that muscle. And oftentimes that's with something called a botulinum toxin injection, also known as Botox, right? Not used obviously for cosmetic purposes, but the same concept applies. By putting that toxin in the muscle, it prevents that painful contraction from happening. Okay. When those things don't work, we do have other options that are a little bit more invasive. Some people need pumps placed in their spine or other procedural or surgical treatments to loosen tendons. But again, our goal is to never let things progress to that point. Our goal is to intervene much earlier with these other less invasive options to kind of help keep you loose and keep you mobile.
Can if somebody so say it has progressed and it's really can it be recovered? Can those limitations be recovered?
Oftentimes to a degree, yes. Again, even if people don't start doing things like injections until later on, it might take a few cycles, but usually you get some degree of mobility restored. The surgical and procedural treatments, again, that's usually when people have gotten to that end stage of spasticity, the contractures, right, is the medical term. And sometimes they might need to actually go and clip a tendon, so it's not as painful, but it's all a balance between preventing weakness, maintaining function, and treating your spasticity symptoms, right? So, and that can be a fine balance in some people because essentially what the medications do, the oral medications and the Botox, is loosen you up, right? And if we're too successful at that, you can become too loose, can cause weakness, and that can cause its whole own host of problems. So that's why it's good to work with someone who has some knowledge, some deeper knowledge about what spasticity is and what these treatment options are to kind of come up with the right concoction for you specifically.
It sounds like a good reason to not neglect it, but to bring that
Absolutely.
symptom forward as soon as you're experiencing it.
Absolutely. Yep. And I
Okay.
think that it is a good thing to mention. I think a lot of people tend to be dismissive of their spasticity symptoms because it is really hard to discern what spasticity and what just might be related to, you exercised harder that day, right? You're having some muscle cramps and stiffness, which happen to individuals without MS when they push their bodies hard. So if you're having problems on a recurrent basis, if they're happening nightly or daily or becoming more prevalent, mention it to your neurologist and have them do a motor exam, right, to actually look at your muscle tone and determine if something's stiff. But yes, being on top of this can be very helpful.
Okay. Thank you. I think that's helpful. Thank you.
Absolutely. That was a great place for the question because I think I have maybe one more slide in this section. And this is a little bit of a sciencey slide. I just put this up here so that we know that there is a treatment out there. It's called Ampera, and the generic names are delfampridine or fampridine. Basically, it's the only medication we have that's shown some effectiveness in helping improve walking or ambulation. And what they used in the clinical trial to determine if this worked was by measuring people's walking speed. Okay. And basically what it does is it helps support the transmission of that signal along that nerve that's been damaged. Okay. And you don't need to know how, but that's how it works, right? It's kind of by facilitating that nerve impulse that's being blocked by the MS lesion. It might also help with MS related fatigue. So sometimes it's you can you can kill two birds with one stone type scenario. So I like to mention that as an option. There are some contraindications if you have a history of seizures or epilepsy, significant liver problems, if you have underlying issues with episodic confusion, things like that, maybe not for you, but otherwise might be something reasonable to try. Okay. Before we switch gears, any questions about the motor symptom section?
Currently, nothing more. Thank you.
Okay, absolutely. So now we are transitioning to our bowel and bladder section. Okay, so we're going to start with urinary symptoms, and this is a complicated subject. So I do have a couple slides here, and I'll try to kind of make things as straightforward as possible. So just kind of to introduce the spectrum of urinary symptoms, again, mentioning that this is very common and seen in up to 85% of patients with MS. Will have some degree of bladder dysfunction. Oftentimes, these are present early on, okay? So they may be present at the time you're diagnosed, and it might actually be the first symptom that someone notices, and up to 1 or 2 out of 10 people. We'll talk about the different types of symptoms, but they can occur in various combinations. Some people, again, might just have one. Some people might have a combination or a multitude of these things. They vary significantly between individuals, and they can evolve over time. So some people might start with more issues with trouble going to the bathroom and then develop later on issues with control of the urine. So it depends, and it's not abnormal for things to change or evolve as your disease progresses. So types of bladder symptoms. There's a medical term called urinary urgency, which is basically a problem with storage in your bladder, okay? Such that when your bladder is filling, your brain is not getting the typical signal to say, hey, we're getting a little bit fuller than usual, right? We might want to start thinking about going to the bathroom. That signal's missing. And what happens is until the bladder is essentially ready to pop, right? You might just finally get that signal that says, hey, you need to go get rid of this urine. And you have very little warning time, and it can make it troublesome to get to the bathroom on time without having an accident, okay? Frequency may also be seen. It's also a problem with storage. And that's when you might be having urges to go to the bathroom often, okay? And usually that's a problem with impaired emptying, meaning you sit down, you try to release your bladder, and some comes out, but it's not overly efficient, right? So you're still having some urine in your bladder. And then as you progress throughout the day, your kidneys functions more water, you produce more urine, that can overflow, and that can cause problems with a multitude of things. What's happening here is basically the muscles and the nerves in the wall of the bladder become less compliant, meaning they become they're poorer at expanding and contracting as efficiently. So it's hard to fully evacuate all of that urine, hence making it so that you have to go more frequently. Okay, and then on the opposite side of the spectrum, there can be trouble with hesitancy, meaning trouble starting your urine. There's a phenomenon known as double voiding, where you might sit down, you can start your urine, okay, but then things might trail off, and if you sit long enough, then you might have a second wave of urine coming out. You might also have a sense of incomplete emptying, okay? And this is because the bladder wall is weak because, again, that muscle tone is a problem, right? And the medical term for that is flaccid, meaning there's just not tone there. And then the other things that can happen is there can be incoordination of the sphincters, which are the small rings of muscle around your bladder that allows it to release in a coordinated fashion, okay? And there's actually more than one, believe it or not. And if those aren't working in tandem, sometimes one will open but the other closes. Of course, urine can't pass, right? And that can be due, again, to the lesions that are in your nervous system. There might be also structural problems. So there might be things like kidney stones that get in the way of the urine coming out, okay? All of these problems can lead to issues with frequent urinary tract infections, right? Because if you're not emptying your bladder, the bladder sitting there, it has more chance to basically incubate bacteria, which if not evacuated can sit there and lead to a urinary tract infection. Or if there's still small amounts of urine and sediment in the bladder, you can form stones in your kidneys, ureters, or bladder. So any part of the urinary system. And then, of course, the dreaded incontinence, right? So this is when the storage mechanism in the bladder is impaired. There are multiple types of incontinence, and people might have problems with multiple aspects of this that ultimately lead to one not being able to control their bladder function. But as we mentioned earlier, there's a phenomenon called urge incontinence, where you don't have that normal sensation until it's right when you need to evacuate your bladder. You don't have enough time and you lose control. That's called an urge incontinence. Sometimes people don't get a sensation at all that they need to evacuate the bladder, and it simply it fills to the point where it begins to overflow. That's called overflow incontinence. There's also something called stress incontinence, which just means that, again, those small muscles that control the valves in the bladder are weak, and they might not be able to hold things as efficiently. There can also be problems with impaired pelvic floor weakness, right, which helps to support everything below the pelvis. And then incontinence can also be contributed to by your motor problems, right? If you physically can't make it to the bathroom in time because you're weak, you have walking problems, then that can be contributory as well. And again, all bladder symptoms can be worsened by UTIs, right? So whenever something worsens suddenly, or if there's a change from your normal pattern, this is something that you should make your doctor aware of, and they should send a urinalysis to make sure that you're not infected. Okay, so general approaches to managing these symptoms. Scheduled voiding, meaning going to the bathroom every so often. Okay, every 2 hours, regardless if you feel an urge or not, that can be helpful. Also managing your fluids. And I'm not saying this to say don't drink water, because drinking water is very important, right? But it's kind of just being cognizant about when you drink it, right? Don't drink a liter of water before bed if you're going to have to, get up and rush to the bathroom in the middle of the night. And on that, kind of on that subject, avoiding things that are known to irritate the bladder, like citrus, spicy food, and things that increase production of urine, like coffee, tea, or soft drinks. And then smoking. Again, smoking can be very irritative to the bladder and make you feel like you need to go more often. And then, just like every other aspect of MS care, exercising what's weak can be helpful. So performing pelvic floor exercises can be very helpful. And then making sure you're not constipated, right? Because constipation can physically impair the bladder from doing what it needs to do. And then managing weight. If you're carrying a significant amount of weight in your abdomen and that's pressing down on everything in your pelvic floor, again, that can make it work less efficiently. So thinking about all of these aspects can be helpful. Okay, and then treatment of incontinence, implementing those general approaches we just reviewed. There are some medications that can be helpful with this. I always say ask your doctor to check if you're taking any other medications that might worsen this problem, right? Because urinary problems can be a side effect of other things, so that's important. When medications fail, there are also other things that can be done to help with bladder function. Believe it or not, Botox injections to the bladder can be helpful. And there are also kind of in development multiple surgical devices like stimulators that can help kind of to jumpstart the function of the bladder, help it contract, help you empty. And oftentimes that requires consultation with a specialist to see if that might be something you qualify for. And then impaired emptying issues. Again, treatment depends on the cause. Some people use manual pressure on their bladder to help evacuate that. That's something that was advised historically, may not be the best solution, given we have other things that can help nowadays. There are some medications out there as well that can be helpful, but they're not super effective. Again, if you can't get any urine out at all, sometimes using a catheter intermittently is necessary. There are people who rely exclusively on catheterization, which it can be done. It can cause some irritation again to the urethra over time as well. So we have to be cognizant of that. And when that's an issue, I always recommend that a patient consults with a urologist to see if there's any sort of other diversion for the urine that can be helpful, whether that be a catheter in the belly or whether that be drainage into some sort of other collection device. Okay. Long story short, with the bladder symptoms, if you have a mixture of these things, it's always recommended that you see a urologist, okay? Because what they will do is they will do something called urodynamic testing, where they'll actually measure, they'll do some testing to figure out what's not working and what's not working where, okay? And then they will recommend what, if anything, a patient qualifies for based on their pattern of symptoms. So other reasons you might want to see a urologist, again, if you're not responding to these other therapies, or if you're having complications of your urinary symptoms, like urinary tract infections frequently, bloody urine, or having difficulty with kidney stones.
Sounds like it's an expansion of your care team. So not just your MS doctor, your neurologist, but also a urologist. So,
Absolutely.
yeah.
And we frequently consult with our urologists for our patients because, again, this stuff is complicated. Neurologists are capable of kind of making an initial best guess at what medication might help. But if that doesn't work, I have a very low threshold to get someone connected with a specialist.
Okay, perfect. We have a couple questions.
Yeah.
Can we take them? This person asks, any evidence that saw palmetto supplement and lycopene supplement is good for bladder control? Do you know anything about either of those supplements?
Yeah, I mean, there have been lots of smaller studies looking at that in the past, and I think that the evidence is mixed, meaning some trials showed that it was helpful for some patients and some showed no difference. I don't think that there's much harm in trying those things. I think, of course, on an individual basis, I would recommend you speak to your neurologist and make sure that there's no other medical reason why one of those supplements might be harmful to you. But if it's something that you've tried and works, yeah, absolutely. By all means, I would say continue.
But it's always important to list it as one of your medications so that everybody
Yes.
knows when you're using it, correct?
That is correct.
Yeah.
Absolutely.
So this is well, I just wanted to ask, are any of these symptoms more prevalent in males versus females? Or is it kind of across the board?
It's definitely across the board. I would say it's more common to see these symptoms in patients with spinal cord lesions. Okay. So it kind of depends. I would say it's less sex based than how your MS has affected you and what parts of your nervous system have lesions from your MS.
Interesting. And then this might be for later, but I'm just going to read it now. Practically, how do MS patients efficiently deal with doctor appointments? Can they do remote appointments? Seems out of state virtual appointments are illegal nowadays. I really don't know how to answer that, but I know one.
Yeah.
Mhm.
Absolutely. And this is like an actively evolving thing, right? So the rules, I feel like, at least on my end, I feel like they change constantly. But I know at least at our center, we're working to get providers licensed in other states, right? And kind of diversifying amongst our providers who's licensed where, so that we can actually expand our reach beyond the borders of Ohio out into the greater, the United States and even beyond. But of course, those are logistical issues. I think leveraging telehealth has been a massive improvement in the care of our MS patients, and we're currently doing a lot of research on determining if there's any difference in outcomes actually between patients who receive primarily in-person or virtual care. And so far, we think that people do just as well. So my hope is that by collecting those data and publishing that we'll be able to advocate on a legislative level to allow better access to telehealth care.
Yeah, especially since transportation can be a real challenge for persons living with advanced MS. So,
Absolutely.
okay, we're going to go back to your slides because we are down to 11 minutes, if you can believe it. And I think we
I
still
see
have a
that.
good bit of your deck.
I see that. I know. I know. And we'll, like we mentioned, we'll get to as far as we get. I'm glad that we've intermixed questions. So we'll keep on trucking here. But I think all of those are great questions, and I thank you all for contributing. So just briefly mentioning bowel symptoms, again, might not be as bothersome as the bladder stuff, but if present, can be have quite a negative impact on your quality of life. And people might have issues with chronic constipation, leakage of stool, complete incontinence, or a combination of all of those. Okay, depending on what the predominant symptom is, we can help with medications, right? So if you're having problems with loose stools or diarrhea, we can do things like bulking agents to try and increase the volume of your stool. If you're having problems with constipation, we can introduce stool softeners or motility aids to actually help encourage the what's called peristalsis, so the squeezing along the bowel to help the stool pass. And then there are things like making sure your diet consists of a good variety of foods. Again, whole fruits, vegetables, and whole grains, right, to help kind of improve the composition of your stool. Staying hydrated, right? If you're dehydrated, there's not enough liquid, it can make you very constipated. And then exercise, just moving your body also actually helps facilitate that peristalsis and the movement of the stool throughout your GI system. Okay, we're going to keep on going. Fatigue. And fatigue, I would say, is the symptom I deal with most in my MS patients. It's super common almost across the board, and it often is there every single day, right? And as we mentioned earlier on, it might occur in the morning. Even after you've had a restful night's sleep, you have a good hour or two, and then you're like, gosh darn it, here comes the fatigue again. I just feel terrible. Not uncommon, unfortunately. And oftentimes it does tend to worsen as the day progresses, as you've kind of used up your energy bank, right? Which can fluctuate with time, and your bank can be smaller as you progress through the disease course. Okay. Oftentimes people will notice that their fatigue is worsened by exposure to high heat or humidity. And fatigue can really fluctuate unpredictably. Like you might be feeling well, when you get to work, and then you get through a task and you're like, oh my gosh, I'm wiped again. What happened? Not uncommon. And MS related fatigue is its own beast. It is more severe than normal fatigue. Okay. And I think that for patients, it's really hard to explain that to someone who doesn't know about MS, whether it's a friend, a family member, a coworker, right? But it really can interfere with your daily responsibilities, and it can be quite debilitating. So fatigue in MS can be due to a number of different things. Deconditioning can contribute, right? So if you're tired, weak, or having trouble with your motor function, you might not be exercising as much, you lose muscle mass, you get deconditioned. Okay, and then there's something called handicap fatigue, which means it might just take you more effort to do the routine tasks, things that normally would be much easier for you because of your underlying condition. And then on a neurologic level, lots of things contribute. Again, motor problems. So you might not have as much endurance as you did in the past. That heat might really make your symptoms worse, make your weakness come out to a greater degree, and require even more effort from you to do the same task. Or you might have what's called systemic fatigue, which means you just don't feel good. You feel tired. You have this what's called lassitude, meaning you don't have motivation, right? And that's all related to issues with kind of lingering inflammation, all of the kind of immune factors that are at play, kind of causing these lingering symptoms. Okay. So how do we manage it? Number one, always rule out and address anything that's contributing. So if you're sleeping poorly, right, you have insomnia or you have sleep apnea, needs to be addressed so that you're actually getting restorative sleep. If you have mood problems, depression, anxiety are highly correlated with fatigue, right? So if you have unaddressed mood issues, that might be a significant contributor. And then your day-to-day activity, right? Normal stressors, that can make your fatigue worse too. So strategies include kind of having a good idea about what your daily energy bank looks like and kind of allocating that energy strategically based on what you know you have to do throughout the day. prioritizing tasks and prioritizing how you're allocating that energy. Managing your exposure to heat. And there's lots of ways that you can do that, right? Either whether it's carrying a cold water bottle with you, wearing a cooling vest, things like that. If you notice that your fatigue is highly correlated with your temperature environment, that can be helpful. Again, the exercise, we talked about that initially, so I won't belabor that point again. And then things like cognitive therapy, so reframing how your brain processes your feelings of fatigue, and using medication, okay? And there are medications out there that can help. I tell my patients it's usually about a 50-50 shot. You know, some people respond, some people don't. But if there's no medical reason why you couldn't try one, it's reasonable to ask your doctor, okay? Energy conservation. So we talked about this again a little bit before, or at least alluded to it. So hooking up with a physical therapist who can help you work on your walking so you're not wasting energy with movements if you're having to compensate for some weakness. Managing your spasticity so you're not fighting against stiff muscles when you're trying to move. Occupational therapy can help you adapt your normal day-to-day tasks to make them more energy efficient. And then, of course, integrating any changes to your work environment, like simplifying tasks or adapting tasks, should be done to the degree possible. And then this last bullet point, wouldn't it be lovely if we could all have scheduled rests throughout our day, right? Not necessarily feasible, but if you are lucky enough to be someone where your day-to-day schedule allows that, absolutely take your scheduled rests. They are helpful.
With their siesta in the afternoon, right?
Yes, I know, exactly.
So
Exactly.
we need to all kind of revisit that.
Yeah. And I apologize. I jumped the gun a little bit here on the heat management for fatigue. Same things apply. Limit activities in hot environments, stay in air conditioning, cooling vest, cool bath, shower, etc. All of that can be helpful. There's some evidence that aspirin might help combat this actually because of what the functions in the body that the aspirin blocks. So again, if no medical contraindication, might be something that could be tried. Okay, I think I'm going to skip over exercise because we already talked about that. CBT, again, is reframing how your body thinks about fatigue and how there have been clinical trials that have shown in the past that over the long term, there can be some differences. But if you don't keep up with it, like if you don't keep up with this training, oftentimes that effect is lost. But what it helps with is by improving your perception of fatigue, helping you get back to better physical activity, helping your sleep, and improving your physical function. All of these combined can help mitigate your fatigue symptoms. Okay. I mentioned there are medications out there. We don't need to belabor that. Reasonable to ask your doctor if you're having trouble. Okay, and then I'm just going to take a couple minutes to go over mood symptoms. Okay. So I think I'd like to summarize this by saying mood symptoms are very common in MS, and it's not something you're choosing to have. It's something that's part of your underlying disease. I oftentimes have patients coming to me and saying, you know, my family doesn't understand, like, why am I depressed? Why am I anxious? I don't have any reason to be this way. And I say, no, that's not true. It's part of your underlying disease, right? And there's no shame in that. It's important that you communicate these things to your doctor so that they can be addressed. And mood fluctuations are very common as well. So people might experience a combination of depressive feelings, apathy, meaning, hey, I just don't care. I have no feelings about anything either way. Or you might be really irritable or moody. All of these things are common in MS, okay? And as you all know, there are many, many medical treatments out there available for mood symptoms. But what I would like to highlight is that research has shown that it's not just medication alone. It's a combination of medication and psychotherapy that really help to best optimally manage these symptoms. And stress management, right? That's hugely important. I think this goes along with the fatigue conversation that managing your stress can help mitigate your MS symptoms as a whole, right? Because if you're having stress, that can make your depression, your fatigue, your overall sense of well-being worse. So making sure that you are taking the time to think about this, right? And integrate this into your day-to-day, and part of your MS treatment plan, I think, is important. Okay. So I know that we're very short on time. So I'll just briefly mention that we need to approach this from multiple angles, right? So integrating people like social workers, behavioral health specialists, engaging in your community with support groups, I think can be massively helpful in, again, kind of just building your support, building that sense of community and caring for you as a person as a whole. Okay. I don't know where my slide went for the cognition, and I don't know if I guess I just have one. So thinking, memory, concentration, right? All of these things are challenging, and they can be correlated with your other MS-related symptoms, and they're very common even super early on in the disease. Okay, so if you have symptoms, request to be screened. We have lots of tools available that can help us kind of determine your likelihood of having a true underlying cognitive impairment. And then if one of those things is identified, we can help to rehabilitate that, okay, and work on those weaknesses that you might have. All right. Closing statement. Your symptom priorities might differ from your neurologist, okay? And this is just a study, long story short, shows that what the neurologist thought was important might not always align with what the patient feels is important. So make sure you let your provider know what is bothering you. Okay. And again, medications are not the only approach. We have to look at this as a whole person, balancing your social aspects of health, mental, physical, all of the above. Okay.
That you said what your doctor's priority may be completely different than what your own priority is. And so definitely open up those lines of communication to put you both on the same page. Another takeaway I'm thinking is you only see your doctor a couple of times a year. So always keep a good symptom tracking log so that you can share with your doctor when you meet with your doctor, and because they're going to ask, and then if you haven't tracked it, you're not going to remember a lot of times. I kind of think that is an important handy tip.
Yeah.
If you have 3 or 4 minutes that you can stay, we do have a number of questions that have popped into the box. I also wanted to mention to people that we do have a great brochure in our library from the Multiple Sclerosis, National Multiple Sclerosis Society, called You Look So Good, because on the outside you look so good, but it's a really great description that you can hand to people that help them understand that what's going on inside your body is very contrary to how you look on the outside. So all right, so here's some of the questions, and they're all kind of curative. Is there a cure for MS in the pipeline, e.g. rituximab? I don't know how to say that. Does vitamin D megadose A prevent B treat MS? And number 3, can you talk about generally how to prevent MS? So that's a lot of questions in 1 minute. Go.
Yeah. So unfortunately, there's no definitive cure for MS right now. But we do have good disease modifying therapies, right? And that just means that once a diagnosis is made, we're pretty good now at stopping the relapses, the new lesions in their tracks. But we don't have what's called remyelinating strategies, meaning we can't put that covering back on the nerve once it's been stripped off. And because that nerve is exposed, right, to the environment of the body, it wears down faster, right? It's like a barn in the sandstorm, right? That sand is constantly whipping against the side of the barn and stripping the paint off. Unfortunately, we don't have anything that puts that protective covering back on the nerve to slow that down. A lot of smart people at the NIH are working very, very hard on that. There are some things that are in animal trials currently, but that's still several steps away from human clinical trials. I do think that in our lifetime we will see a cure, however. Okay, so it's on the horizon. It's just it's going to be some time before that's available. Um,
That's
I
super
think the
exciting.
question, it is. I mean, and even in the past 20 years, right, there have been massive strides made in management of this disorder. Um, Vitamin D deficiency, we know, is correlated with development of multiple sclerosis. Okay, so that's one thing that can be done as kind of more of a mitigation strategy. We do recommend that people who have an MS diagnosis supplement their vitamin D and maintain at least an average level. Mega dosing of vitamin D, I think, has shown some equivocal results in clinical trials. It's certainly not curative. It's not considered an MS disease modifying therapy. So it's good to do in conjunction with your disease modifying therapy. I'm trying to remember what the next part
No, that
was.
was it. Does vitamin D megadose prevent or treat MS? And the other one was, can you talk about how to prevent MS?
Right, yes. Yeah. So that, I mean, that's an involved question, right? Because MS is a really complicated disease. And I still, to be honest with you, I think any neurologist would say we don't fully understand it yet. We're making strides in that regard as well. We know that you kind of have to start out with the right genetic makeup. And there have been over 250 different genes implicated in MS predisposition or risk. Okay. Just because you have that certain genetic makeup doesn't mean you'll develop MS, but you kind of have to have that as a basis. Okay. And then on top of having the right genetic basis, you have to have a couple other triggers fall into place. We think that exposure to the Epstein-Barr virus, which is the virus that causes mononucleosis, is kind of the key that starts the ignition of MS beginning. Okay. And when that key is turned, that ignition started, other things like low vitamin D levels, childhood obesity, smoking exposure, your gut microbiome, which are the healthy bacteria that live in your abdomen, all of these things in combination kind of create this perfect storm for someone to kind of flip the switch for their nervous or for their immune system to start causing inflammation in the nervous system, which we call MS.
Okay.
I tried to
Two
simplify
really
that,
quick
but it's
yes or
common.
no's. Does infrared radiation treat MS fatigue? And does acupuncture treat MS fatigue?
So I prescribe acupuncture quite frequently for MS-related pain, spasticity, fatigue. I can't quote you any clinical trial data, but anecdotally, again, I don't think there's any harm in it, and I have a lot of patients that benefit. So absolutely, I think that should be integrated if it's something that you find helpful. Infrared therapy, I have seen some sparse data on. I will say I'm not as up to speed on what the most recent studies have shown on that. But similarly, what I do know about it is that it has been shown to kind of decrease some inflammatory markers. So theoretically, decreasing inflammatory markers again can help support the overall kind of shifting the immune system to a less inflammatory state, which could be helpful for MS. But I don't have a great definitive answer for you on that one.
Okay. And last question, what is the connection between lupus and MS?
Yeah, good question. So they are both what are considered autoimmune or immune-mediated diseases, right? So basically what happens is that your immune system is overactive, and an overactive immune system can manifest, meaning it can come out in different people in different ways. Some people might develop MS, some people might develop lupus, some people might develop psoriasis, right? All of those things are problems with the balance between inflammation and calm in the immune system. And it's kind of like just the inflammation overspills and it starts to affect something in the body. So that's how they're tied together.
Okay. All right. Well, gosh, we covered a lot of ground today, Dr. Carla. It was amazing. I really appreciate all that you brought to our table. And I want to say thank you for accepting my invitation to come today.
It's my pleasure. I want to thank you all as well for being here. It's an honor to be asked to share and again to contribute to the care of patients with MS and their families.
Okay. And then to the audience, I'm just going to say today's program was recorded. It will be available on our website at ccednv.org/lunch. By the end of today. Kurt usually has that right up there. So please rewatch it, share it with anybody else that you know may benefit from it. I also want to put a plug in for the walk for the National Multiple Sclerosis Society. That is going to be here in Las Vegas on Saturday, April the 5th at Sunset Park, and you can register to be a walker. You can find the walk on the nationalmssociety.org website. So look up National Multiple Sclerosis Society, and it's a .org. So look that up, and then you can sign up for the walk. And with that, my friends, I bid you the best of weeks. So thank you, and we hope you'll join us again next Wednesday at noon. Be well.